Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Schaefer. Welcome to Monday Health Minutes. Today we're talking about a class of medications that's really changing the way we manage type 2 diabetes. They're GLP-1 receptor agonists. Now, these drugs lower blood sugar. They also help support weight loss, which is a major benefit for a lot of folks. So are they right for you? We're talking with Valley Health family physician, Dr. Amy Marsteller, about that today. Thanks so much for being here.
Thank you.
This is a big class of medicines. Tell me how they work and how do they work for type 2 diabetes?
It is a big class of medicines. They work in our gut, and they're hormones that work in our gut. When they attach, they send a signal to our pancreas to help it release insulin. When it releases insulin, that helps us use the glucose that we have better. But they're also slowing digestion, and then they make us absorb our carbohydrates a little slower.
Okay, so a lot of these medicines, they help people lose weight, and that's important for diabetic patients. Is this intentional or a side effect?
It was not intentional, although it's a great side effect.
It is a great side effect. Who doesn't want to shed a couple of pounds, right? It was just sort of a happy circumstance that's really been a huge benefit. What makes GLP-1s different than some other older diabetes medications?
It's a big question because there are so many different older diabetes medications, and it doesn't mean that older diabetes medications aren't good. But with some of the medicines that we first developed, an insulin that you think of, which is a life-saving medication, they can often cause weight gain. And the nice thing about this family of medicines and some of our other newer ones is we have weight loss as a side effect instead.
How can you tell when it's time to maybe, if you've done some of the other older medications, when should you consider maybe switching over to GLP-1?
I think that is always a question you should talk to your primary care provider about. The answer can be different for everyone.
Who would be a good candidate for GLP-1 medication?
Anyone with diabetes could be a candidate, but there's so many nuances you need to talk to your primary care provider.
Okay. Let's talk about contraindications. Who would these maybe be an issue for? What kind of other conditions would maybe not make GLP-1s a good choice for you?
The things that you need to think about: if you have a history of medullary thyroid cancer, if you have a family history of multiple endocrine neoplasm, or if you have a personal history of pancreatitis, that could be a contraindication for you. Gastroparesis, which is fairly common in diabetic patients too, you just have to be careful with the medicines.
So health conditions, kidney conditions, those are all okay?
Yeah, actually, some of the medicines have shown a benefit with cardiovascular disease. Semaglutide in particular has shown reduction in heart disease in diabetic patients, and also it slows the progression of kidney disease in diabetic patients.
Okay, so all of this sounds great. I mean, weight loss, lower blood sugar. Let's talk about some side effects, because there are some side effects that come along with it.
The way that they work, they also are slowing digestion in our gut, and when we're slowing that digestion, that's really where the side effects come from. A lot of GI side effects, nausea, constipation, diarrhea are all pretty common. Those things are usually transient. If you can get through the first couple of shots, they usually get better. And if we teach people how to eat low fat and smaller portions as they are taking these medicines, that often helps these side effects.
What role does diet and lifestyle play? I mean, is this medication, it can't fix everything, right? We still have to modify how we are eating and working out.
It does not fix everything. It's a great medicine. It's an adjunct to diet and exercise. Healthy diet and exercise are always going to play a key role in really everything in our life.
So you can't take the medication, do whatever you want?
No.
No, it doesn't work that way.
It does not work that way.
It does not work that way. For patients with type 2 diabetes who are sort of, they've been worried about it or thought about it, what would be your advice? What would be your suggestion of whether GLP-1s might be right for them?
I hope that they have a primary care provider they can talk to, and to go in and really sit down and talk to them if it's a good option for them.
Cost is a thing, and sometimes insurance covers it and sometimes it doesn't.
Cost is a huge barrier. For diabetes, most of the time the medications are covered. Unfortunately, for weight loss, often they are excluded. Really, if everyone that qualified for these medications was prescribed these medications, our healthcare system would go bust because insurance companies just can't afford the cost of them. So we're trying to figure out how to make that work. The industry is trying to hopefully make some of the medicines less expensive. There are a couple of direct-to-consumer options. Lilly actually has a direct-to-consumer that's a little bit less expensive than the traditional price.
Okay, and final thoughts, final words of advice for someone considering it.
Have a primary care provider that you trust and that you can go talk to.
But it might be a great option for your diabetes control. Yeah. All right. Dr. Marsteller, thank you so much. We sure appreciate it.
Thank you.
Thanks for checking in on Monday Health Minutes.